So hey, welcome everyone, and hello. Welcome to our accidental drug poisoning crisis community of practice. Yes, we changed the name, but we also changed like the whole thing. My name is Bang Lai. I'm the national curriculum lead here at St. John Ambulance, and I will be your host for this lovely event. Try not to fall in love with me. I'm kind of a hot mess right now. This event, this panel, this whole kit and caboodle has been a natural evolution of our previous summits, like I was mentioned before. And of course, they were focused on the opioid epidemic. And now I think it's all kind of grown up. You know, we're also recording this thing, as I mentioned before. So, you know, we're going to host this on our website, and you can watch that later, and you're welcome for that in advance. But this whole thing, all of these get-togethers that we've been having are all because of you, right? And your interest in what our speakers and panelists talk about. It's because you care about your community and what and you want to know more about how to help folks who are wanting that help, or just making the lives of people that we care about safer, right? So in the past, the way we would do this is we would have speakers that would talk about what they do, and then afterwards we'd introduce like an intervention or an activity based on your feedback. And then, it was a way for us to get a bit more interactive, because clearly we live on our screens right now until we can all meet in person for one of these things. So let's talk about what's new this time. And to be clear, this is an order of magnitude greater than its previous iterations. First off, we have Carly Babb, our National Community of Practice Coordinator, running the ship behind the scenes. They've put together this incredible advisory committee of folks with lived or living experience that also work in support positions, because as always, this event is made by and for us in this field one way or another. And it makes a whack ton of sense to be guided by our own folks on how to run this thing, right? But there's more. So these big events are going to happen every 3 months, and we can host around 300 to 500 people in these particular COP events. But now you will also have more specific and intimate gatherings to hold conversations about topics that perhaps require more nuance and more of a micro approach than this current format could accommodate. These smaller events will hold a maximum of 100 of only the coolest people. And it's going to cater to communities that live in an ecosystem that, deal with a specific topic. And of course, we'll be hosting workshops, keynote speakers, creative outlets, all in the spirit of collaboration and building a stronger community, as designed and defined by that community, right? They're all going to be different, and they're going to happen like every month between these big ones. So join us, or whatever. I'm not the boss of you, but be cool, hang out with us. All right. But you're going to get to chat with folks on like a national scale, and that's pretty cool. So we also have a budget for this thing now, so we have to spend it. So please join us. Okay. So now we've talked about all of that stuff. Let's talk about what's going to happen today. All right. Today we have some new friends with us, and instead of it being like a 15-minute intro on what they do like we did in the past, we're just going to have a conversation. We're actually going to dig into what they do, how they do it, but then all the stuff we never got a chance to in our previous iterations of this thing. It's literally like if you went to a Star Trek convention and like sat on a panel about why Discovery and Strange New Worlds are the best Star Trek ever, and I will fight you on that. But this is an open conversation, and as always, we will never police your speech or language, so long as you're not like, being a jerk to somebody or a group of people. But like, say what's on your heart. Speak your truth. That's the whole point of this thing, right? The way this discussion will go is, after I briefly introduce our guests, we'll start the conversation off with a few questions for the panelists to discuss, but then we'll let the conversation go where it goes. We also have some questions that we've pulled from some of you keeners out there in the audience, which we will discuss after that main chat is done. And then after it's all said and done, we'll have a live thought exchange that will help inform what direction we take this COP in as requested by you, the community. All right, so without further ado, please allow me to introduce our lovely guests today. First, I'd like to introduce to you our friends from VANDU. I know there's a bunch of folks in the room right now, but by the way, VANDU is the Vancouver area network of drug users. And I think today we are joined by John Braithwaite, Martin Stewart, Flora Munroe, Lorna Bird, and Kevin Yake.
Yeah,
Welcome.
there's only three.
Sorry?
There's only three of us. There's only three of us.
Okay, well,
There's Lorna Bird, Flora, and Kevin.
thank you so much for that correction. I appreciate it. Welcome. I'd also like to welcome Caitlin Shane from Pivot Legal Society. Welcome, Caitlin. And finally, I'd like to welcome Jeremy Kalicum from the Drug Users Liberation Front, or DULF, if you're into the acronyms. Welcome to all of our speakers. We're so honored to have you with us today, and thank you for joining us. How about in the order that I introduce you? Would you all just hop up on mic and then just give us a quick intro into about who you are and what you do before we get into the questions? VANDU, if you wouldn't mind starting us off. We can maybe unmute them. I don't know if we can do that. Oh, maybe VANDU's frozen right now. While VANDU's sorting that out, Caitlin, do you mind hopping on and letting us know what you do and where you're from and what's going on over there?
Sure, yeah. Hi, everyone. My name is Caitlin Shane. I'm a staff lawyer of drug policy with Pivot Legal Society, joining you from the stolen lands of the Musqueam, Squamish, and Tsleil-Waututh peoples in so-called Vancouver, BC. Yeah, I think, sorry, and the question was, what do I do?
Yeah, what are you doing right now, pal?
So I'm sitting in an office. It's very loud. They're currently ripping down a viaduct outside of our office, so there will be jackhammer noises probably in the background. But what I do on a daily basis is work with people who use drugs and other allies in the community, including DULF and VANDU. And we kind of use a diversity of tactics to challenge different laws and policies and practices that are being weaponized against people who use drugs during various health crises.
Yeah, thank you. Thanks for sharing that. Jeremy, welcome. Would you give us a breakdown of what you do as well?
Sure, yeah. My name is Jeremy Kalicum, also calling in from the unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So I'm the co-founder of the Drug User Liberation Front, and basically what our group aims to do is provide a level of regulation to the illicit drug market that's currently unseen and it's never been done before, at least in my knowledge. My background is in chemistry and public health, so what we're trying to do is try to bridge some of the gaps between tools that are provided through these sort of disciplines and bring it into a way that can really help the community and save lives.
All right, thanks, Jeremy. Folks from VANDU, Flora, Lorna, are you guys still there? Can you hop on and? Are they not there? Okay. Well, in case you don't know, VANDU stands for the Vancouver Area Network of Drug Users. It was formed in 1998, which in my head is still only 2 years ago, to bring together groups of people who use drugs. VANDU is dedicated to improving the lives of drug users, their families, and our communities. They're committed to increase the capacity of people who use illicit drugs to live healthy and productive lives, and they do this by affirming and strengthening people who use illicit drugs to reduce harms both to themselves and their communities. They typically organize in their communities to save lives by promoting local, regional, and national harm reduction education and interventions. All right, folks. So thank you very much for letting us introduce you. Let's start that discussion up. So friends on our panel, a lot of the folks in our audience might not have a full grasp on what these three organizations have sort of teamed up to do. I wrote in my notes that you Voltroned this thing together, but I'm pretty sure not everybody knows what Voltron is because I'm old. So I'd like to start that question off. Can you describe what it is exactly you three organizations have really come together to accomplish? What is it that you as organizations have done to serve your community? Jeremy, how about I start off with you? How about I throw it to you first?
Can you hear us?
Oh, are you guys there? Oh, hey, VANDU, you're there. I didn't see you pop in. Great. Can you guys hear us okay? All right, we'll tell you what, Jeremy, how about you pop on and I'll get you to answer that one. All right. You're currently muted.
Yeah, maybe if someone gave us like co-host, we could unmute ourselves or something.
Oh, okay, great.
Right now we can't.
Fair enough.
So yeah, I guess we kind of did Voltron this thing together in that that's how we do everything in this kind of, at least in Vancouver and the sort of drug user liberation movement. It's a very kind of collaborative thing that we all do because you know, acting alone never really works. You know, the Drug User Liberation Front is a new-ish organization. We might be kind of rounding close to 2 years, but you know, we started right before or shortly after the pandemic hit. That's when we sort of did our first giveaway. And you know, what was happening in Vancouver, or at least in BC, the overdose numbers began to like skyrocket, and we were hitting, you know, records like month after month, in a situation that was already incredibly devastating. And we just got to a point where we were like, we already know the solutions. We've held big meetings with people who use drugs, with Pivot, with, you know, kind of cutting edge leaders in the field of, you know, harm reduction and you know, kind of substance use medicine or whatever it is. And the consensus was there that all we need is drugs where people are using them, they know what's in them. People can use drugs safely if they only know what they're using and how strong it is. So we pulled together a bunch of people from several organizations that go beyond the people that were here. And, you know, basically we're like, we're going to do this. You know, we can't do it alone. And pulled everyone together, formed the Drug User Liberation Front, and just, you know, did what we needed to do. You know, on the kind of context that everybody, you know, who we asked about, and everybody thought that, you know, it's impossible. Like, you can't do that without getting arrested. You can't go out on the streets and give out drugs without going to jail. Like, that's stupid. You know, I think that kind of speaks to the sentiment where people are like, oh, well, you can do that in Vancouver, you can't do that here, you can do this there, but we can never do that here. You know, everything we've done in Vancouver was on the ground of you can't do that. So that's I think probably didn't answer the question.
Well, it certainly did. I mean, so in summation, right? What you guys are doing as an organization, as a group of organizations, that you're sourcing and testing supply, right, and providing it.
Yeah, that's exactly what we're doing. So what we do is we find drugs on the dark web or in community. The dark web is proven to be a bit more reliable with a few more checks and balances in that system. So
ironic.
Yeah. So you know, my background before doing this was as a drug testing technician, using my chemistry skills to use drug checking technology to tell people what was in their drugs. And the big gap that I was seeing in that system was scalability. And a lot of people were seeing in that system was scalability. If you're just checking at point of care, so you're checking whenever someone's about to use drugs, you're only serving one person at a time. Maximum in a day, maybe if the timing works out good and everyone's like evenly spaced, everyone waits, you can maybe check 40 to 60 people's substances one time. But if you want to really expand that or exponentiate the impact of drug checking, you need to be able to test for a distribution level. And you know, the one way to do that would be checking for drug dealers. But if you you know, have drug checking for drug dealers in a single spot, you know, I certainly wouldn't put it past enforcement to come and, you know, sweep up a big batch of drug dealers all at once and call it a day. So we had to do some creative thinking, and it was that, you know, there was a need for an institution that'd be between the seller and the, you know, ground level buyer. And that's kind of where DULF is began to insert itself. And there's a few ways of looking at it and kind of framing our project. You know, certainly people do try to frame us as, you know, just kind of drug dealers. but more it's really just an expansion of drug checking services. Only we're exponentiating, we're making it much more impactful.
So to that end then, right, you're the work that the three of you are doing is, I mean, listen, I mean, let's call a duck a duck. I mean, there's a high potential for calamity in all of this, but you know, it sounds to me that, you know, the work that you're all doing are setting up provisions to make sure that people are safer. You know, I mean, you're all heavily enmeshed in that type of work. I mean, maybe Caitlin, maybe you can answer this question, right? How did you go from this conceptual idea of providing safe supply when there is none, while also not getting nicked on it? Like, how are you doing that?
So, I mean, I can't take any credit for sort of the work that's been spearheaded by DULF and VANDU to kind of put this action in place. I mean, what I will say, and Jeremy spoke to this earlier, is like all of these actions start on a playing field where it's criminal to take action to save lives right now. It's criminal to possess, purchase, like everything is illegal related to drugs. And so there's kind of no getting around that. The important thing, and something that I think is often lost sight of, is people will look at Vancouver and see that, you know, at this point there are, even though we're nowhere near having kind of the appropriate supports and state regulations in place, things have progressed because people who use drugs have put their lives and liberties on the line to do what's right. And the situation we're now in, where we do have at least some outward support from government and nominally from police, it didn't just happen because these happen to be like benevolent actors. It was like work, decades and decades of pushing these people, breaking the law, and doing what's right. So I think that kind of background work often gets lost in the mix. Is it's easy to look at kind of the situation that Vancouver is in now and say, well, Vancouver has a progressive whatever. And it's like that took years and years and years of hard work and arrests and death and, you know, constant grieving. And so, yeah, it was hard fought. And I suppose there is no real way to get around the illegality of things. Like Jeremy said, you have to be creative.
You certainly are.
Yeah, and you find your allies, right? And I mean, Pivot's role oftentimes in these things is providing legal advice in terms of what is a legal pathway to do this. And, you know, sometimes there is an illegal way to do it and you do have to break the law, but how do we make a legal argument that if an arrest happens or if people are cracked down upon, like, how do we respond legally and what kinds of legal arguments can we make? But the actual action, the work is being carried out by groups like DULF and VANDU and people who use drugs, who are filling in where government and police have completely abandoned the community.
So that raises a lot of questions that I wish I could order in my head. But I mean, like you must, as the three of you have faced significant barriers to get to where you are. Lay it out. I mean, what were the biggest sort of blocks for you and how did you overcome them? High level, because I'm sure, you know, if you drill down to where it actually is, this is going to be an 8-hour thing, which I'm here for, but you know, people got meetings.
Yeah, I think, you know, people kind of expect and, you know, ask us for like, what was your like grandmaster plan? And it, you know, really wasn't like this. It was like literally like 2 days before our first action when we're like, we're like, fuck it. Like we don't care anymore. Like all of our friends are dying. What's it matter if, you know, someone goes to jail? And we just did it. Like, we're going to set up a tent. Just buying drugs isn't that hard. We'll slap a label on it and we'll give it out. and it was literally just that. We pulled people together. We're like, come support us. Like if you can have community, around a tent to, block police if they try to interfere, like that kind of lends some sort of confidence to the action. But really there weren't a lot of barriers besides, the level of risk that we were willing to take. So, like I think before the first action, we talked to Caitlin, and we're like, what can we do to make this as least risky as possible? Like, I think we have really good standing to be able to do this, and at least, make some sort of argument in a public health crisis that, what we're doing isn't, is in line with responding to a public health emergency. And Caitlin was like, you can do things like not set up in the middle of the street so they come and get you for some sort of like kind of minor violation. They're like, oh, like you're walking the street, you can't do that. So we set up on a sidewalk. It was just, little things like that. And we've really just been going full steam ahead. Like DULF just released the guidelines for the Compassion Club that we're actually going to start. So we're just, trucking along in the best ways possible. And I guess barriers would just be like the barriers that have already existed, like really kind of discompassionate government and people in power who have the ability to make change, like the Minister of Health or maybe the Minister of Mental Health and Addictions, but the government asking them for help and them being like, this is illegal, or asking people for funding and be like, we can't fund anything in relation to your organization because what you're doing is illegal. And then the same organization's coming back and being like, we support you so much, but when it comes down to it, we won't like actually support you in any tangible way.
So how does that conversation go when you're speaking with the government and saying the laws that have been written don't serve the people anymore? How does that reaction work? How does that interaction happen for you? That's for anybody. And welcome back, VANDU, seeing you there on the screen. And welcome back. Like, yeah, I guess we're talking about pushback, right? Like, what are you hearing? What do the conversations look like?
Well, I mean, we have a meeting with the Minister of Mental Health and Addictions at 1 o'clock today. And it's just really frustrating, and it burns you out. Like that's, I think, the biggest drainer of energy in this movement is trying to work with these people who will, put on a face and nod their heads and be like, that's really interesting. And then like when the actually comes down to brass tacks, they're like super not on board. So it's just, you spend hours and hours and hours, unpaid hours, I might add, on these meetings with people who pretend to listen, but don't do anything. And potentially the most frustrating part is when they send some representative who has no power, and then you spend 2 hours talking to somebody who has no ability to make any change.
Yeah. So speaking of change, then VANDU, welcome back on the camera. If I could ask you guys, like with the success of the work that you guys have been doing together, what's that impact look like on the streets for everybody? What is that looking like for the community? How has that actually helped?
Well, actually, a lot of people are like just now starting to get into it. They have an idea of what it is, so they're slowly understanding it more, which is good. So they're coming to ask more questions and what's happening and what's going on and how long it's going to take before we get our shop going.
Yeah,
so to speak.
That's fair.
So people are eager, and they're hearing more and more talk about the Capacity Club and stuff, and slowly it's coming along. It's a bit of work, and so they're eager to get going on it. We started some things. We got a list of people that to start and whatnot, and so it's really early right now, but yeah, I think it's gonna be make a big difference.
Well, we just started a group yesterday. It was they took 50 people, so 20 people are being given $50 to be able to buy safe supply of drugs, and and then the next 20 people, they have to buy their own, but it's really cheap. Like you can pay $1 for like a 10 say a rock that costs $10, you'd only pay $1 for it. So there's 20 more people like that, and then they have 10 more people that if if people fall back and don't want to join in, then the other 10 will be able to. So that's, and anyways, it's really 20 people are starting. We just started yesterday, so we won't know about it for another week. And it
So
was-
what's the demand been like? So you just started up yesterday. Word's
Yeah.
just getting out on the street. Like,
Yeah.
how up to your
Well-
eyebrows are you into this? Like,
Well,
what's
we've
that
had
look-
a lot of people come in and want to become members, right? So they still, and the only requirement to be a member is just fill out a membership sheet. And you have to be a current or former drug user, right?
Yeah.
Current or former drug user. And so a lot of new faces and that are coming around because of this. And I think that's a good thing.
I think that's a really good metric. You're
Yeah.
seeing repeat people showing up and knowing that this is a safe thing to do. Am I hearing you right?
Yeah,
That's right.
that's right.
Yeah, it's fantastic.
Yeah, 'cause
Jeremy, I
the
see your
more
hand up.
people
Pal.
come
Oh,
in
sorry, go ahead.
and the more people come in and realize what we're doing at VANDU, then it becomes more aware of what, oh, this is like, what we do is good. It's like, we're not here to harass, or we're not here to stop you from doing drugs.
We just want you to do them in a safe way. So
Yeah.
you're not harming
okay.
yourself or harming
Yeah, what's
anybody
telling
else.
people to stop doing stuff we're gonna do? Like, anyway. Jeremy, I saw your hand up there, pal. What you got?
Yeah, I just want to offer some clarification on the scope that the compassion clubs have been operating so far. So what we've done is we've done several, probably 7 or 8, one-off giveaways.
Oh, yeah.
So, we get the substances, we box them, we label them, we test them, and then we give them to members of drug user groups like VANDU, like Coalition of Peers Dismantling the Drug War, like BC APOM or BC Association of People on Opiate Maintenance. Caitlin's holding up one of those boxes. That's exactly is one of the boxes. Maybe has drugs. I don't know.
Who knows? Who knows what's in that thing? I mean, I don't.
Yeah, so we've done that, and those have been one-offs, kind of proof of concepts. We do that in protest and issue demands that the government give us sanctioning to be able to run it consistently in a program that where we won't be at risk of arrest. And we wrote a big SUAP, substance use and addictions programming from the Health Canada to get money and sanctioning to do that. We also wrote a request for a Section 56 exemption, and that's basically like a kind of pressure release valve on the Controlled Drugs and Substances Act, where the Minister of Mental Health and Addictions, or it's the Minister of Health, maybe the Minister of Mental Health and Addictions can say, okay, you can do this. It's not prohibited under this act anymore, and write some sort of document.
Because basically what we're looking at is they've done that with cigarettes, they've done that with alcohol. Why can't they do that with drugs? Like, what is the difference?
Yeah, no kidding.
So we wrote those, and the government said no to the SUAP, said they intend to say no to the exemption request, but have not outright said no. So we pretty much hit a dead end there, and we're like, we have to do it anyways. And we're gonna operate a club where we're gonna have a specific set. We're gonna have a set of 20 people who are gonna be able to access the club in a regular way. So they're gonna be able to
That's
access.
when we just started.
And that's what we're getting started. Yeah, that's right. And we're gonna do a research project on that, which I think will be the first of its kind, to hopefully show that this guy doesn't come crashing down when you have a compassion club and you have people who can buy substances of known potency and quantity from basically a club. So we're planning on starting that in a consistent way, but we haven't given out drugs consistently yet.
I mean, arguably, you're creating a cigar aficionado club, but not cigars.
Yeah.
I mean, I don't know if I'm gonna get in trouble saying that, but that, I mean, that's what you're gonna do it.
Well,
Am I
that's what
wrong?
VANDU does anyways. We don't
What's
have
that?
to, we don't, that's what VANDU does. We just do it and then get permission later.
Get shit later.
Okay, so I mean, I'm just gonna ask because, like, I mean, we're all pals here, right? What kind of trouble have you guys gotten into?
Well, you know what? We used to have an unsanctioned room for using, and now we have one that they
Yeah, I
give
built
us
one of those
24 hours. That was what, 6 years ago, on December 16th, 2016. They gave us 24 hours to get a room ready, and we had it ready, and that was, we started our
Yes.
injection room. The
Nice.
OPS, and it's working well. We haven't had not even one fatality, so we're doing something right.
Fantastic.
And we're back up to getting 6 people in the room at a time. We had to put it down to 4 because of the COVID.
Yeah,
And so
yeah,
now
yeah.
we got 6 people again. So, and now they just changed the way we got to like we're only counting how many people come into the room, but now we're counting how many times they use while they're in the room.
Oh yeah. Eh? So that you don't have a time limit, you don't have a cap on that, eh?
Well, we said
Yeah.
15 minutes, but it doesn't work that way. You know, we don't kick them out, you know, but it's kind of just like a guideline. But now, like I say, now we have a thing that we're writing how many times they use, how many one person uses. So you might come back, like come in, use 3 times, go out, come back and use 3 times again. So that's all going to be documented.
Actually, you can be surprised at how much the person does within the 15 minutes itself too. Like, you know, they can do like two shots and then leave for about the 5-10 minutes and come back and do the same thing. So it's like, can't really stop them from, like, you know, oh no, you can only do 1 shot in the 15 minutes, and it just doesn't work that way.
So then what are you learning from you know, this this, I mean, not quite secret, but you know, the unsanctioned room? What things did you expect to happen, but then what are you learning now that are like outside of like what you dreamed this thing would be?
Well, before when we had it, like VANDU's always had a legal, you know, injection room or unsanctioned, whatever you want to call it, and we've always kept records and everything else showing that it works, right? But you know, there weren't many ODs and stuff. Like, you know, like people would come closer. Like, you know, we VANDU, like, we're a peer-run organization, so we know a lot of the people are peer on the ground. So it makes for good conversation in about what's going on in the streets and stuff. But you know, over to like with the fentanyl crisis, like even in the room, like we had right at the beginning, there was quite a few ODs, but we're right there on top of it. So that's the reason for the room. And we're learning, yeah, like something has to be done besides just more in the room. And that's where the idea through DULF and VANDU talking about what's it called, the Compassion Club, and you know, it's safe supply. And that's
Yeah.
exactly what it is, right?
Get rid of the fentanyl and what's that other one then? That what's the heck that other
Fentanyl and what?
We're seeing a lot of reports of xylazine and like, you know,
yeah, there's
benzos getting
different
snuck in.
different stuff.
Benzos, yeah.
Yeah.
Well, that's the thing. We don't have an antidote for somebody that uses benzos. All
Yeah,
we
no
can
kidding.
do is give them oxygen.
Yeah.
Because the Narcan doesn't work on them.
That's right. Yeah,
Yeah.
flumazenil is not something you're ever the public's ever gonna really have. That's the thing that typically
Yeah.
overturns
That's
it.
right. That's
Right.
right.
Yeah.
The hospitals have them, but they won't give it to us.
Well, yeah, for sure, right? And it's a quick acting thing. Like it's that window of success is a very short window, and you can cause seizures really quickly too. Yeah, for sure. Caitlin, I saw that you had your hand up. Thank you, by the way, folks, for sharing that. Caitlin, you had your hand up a second ago. What do you want to share there?
I was just going to add a little bit of interesting history to what Flora and Kevin Lorna were saying, which is like the overdose prevention site and injection rooms that VANDU started running illegally years and years ago is a really good example of like how hard you have to persevere, because VANDU started those rooms again at risk of being arrested. The health authority here in Vancouver actually shut down the site, issued a notice that was like, you have to close. And then at some point down the line, like when the rate of death was continuing to skyrocket, VANDU received a notice from Vancouver Coastal Health asking them to set up again, because they clearly realized that VANDU was right all along and was saving lives all along, and that this was in fact a very necessary health measure. But the way that it happens is so sort of like discrediting of all of the work that goes into it. Like, I mean, you three, Flora, Kevin, Lorna can talk about sort of like the little notice that you were given, where it was like, okay, we need you to start up again tomorrow, and just kind of expect you to do that with sort of no recognition of like the expertise, the work that went into that, the barriers that they were posing for VANDU this entire time, it's just expected that like, oh, okay, now you'll do it tomorrow. But it's a real example of like, you just have to keep pushing and keep doing it. And it's only because of the work that groups like VANDU do, the government ever comes around to actually support it in the end. And then oftentimes takes credit for these ideas that they had no part in organizing in the first place.
And we don't get any credit for anything.
Yeah, because even Insight there, VANDU started that years ago and never get no recognition from them.
You get credit
Whatsoever,
with
not
us,
even
friends.
in there, like, you know, when they're being talked to, like the paper and all that, they didn't, not even a thank you. To say, like, you know, that you started it, that we opened it.
So if I can just recap, like what I'm hearing here is that you got shut down because it was viewed as unsanctioned, but then you were asked to reset up and as subject matter experts,
Yeah,
but then not given any sort of
recognition.
affirmation, acknowledgement that you were doing the right thing all along.
Exactly.
Yeah, we've been fighting for over 20 years for, you know, more injection sites rather than Insight, because there's more areas and you know, there's a lot of risks just going down to Insight. There's risk of, you know, being ripped off, being arrested, you know, and then there's the red zone situation. If you're caught dealing or whatever it is, you're under arrest for. And so they'll give you a red zone. You can't go in that area. And that's the only injection site is in that area. So we've been fighting for 20 years for more injection sites, you know, and it took this fentanyl crisis and some people to die in order to, you know.
Yeah, because
Some people, or 600 people that I know. Over 600 people I know by personal names, you know, that died.
Yeah.
You have a captive audience right now. What do you want them to hear?
That people are dying out there and we need help. We need help. We're doing the best we can, and we just need more help.
Take the gloves off, guys. This is an open space. You say whatever you want.
You know, like
So
I
basically,
figure
get the
the
fuck off your asses and help us
anyways,
here.
like basically,
Like seriously, get your heads out of your fucking asses and help us here.
I'm
sorry,
You don't have to apologize for anything, my friends.
Just
No, yeah,
that pissed me off. There. Like, you know, they sit there, listen, but
Who's they?
see them already? Yeah.
No, yeah, what I was gonna say the same thing basically, like all the OPS is in my hats off to all these other sites too, right? And nobody has died in these sites, but still the numbers are high over the record, right? Like higher than they were when the crisis was, when they declared a state of emergency, right? And it had to be high in order to declare a state of emergency. So, but the numbers are way higher than that. And it's the people like that are using the loan and stuff. So it's about reaching out, getting in touch with those, like, you know, trying you know.
Well, the landlords, like these landlords that on welfare day, they'll say that you can't have any visitors. So then the person that rents that room has to go by and use by themselves.
Yeah.
Then a lot of times they're dead. So that's so stupid. Like these landlords have to get their head out of their asses and do it right. You know,
So
you gotta let the government. It's just you can't make people be alone. They need somebody with them. Who else is gonna put that Narcan in them?
You're 1,000% right. So let's talk about how we do this right. Right?
Yeah.
You've clearly gone, and then 20 years, you've gone from concept to literally doing the thing.
Yeah.
And you've had to fight uphill all along the way.
Oh, yeah.
Right?
Yeah.
What would have made life easier for you to get to the goals that you're clearly achieving now? Right?
Well,
you know the barriers you've had. What would have taken those barriers away from you? What's available now that could be?
Little understanding in the government, like you open their ears and, you know, take your blinders off and realize what's happening, right? You know, this city is, like, there's a lot of users, right, in the downtown east side, and it's not going away today, right? So work with it, right?
I think that doctors should be able to give you a prescription for what you want and need, instead of something that you're not going to use. You're going to go sell that, and and then you end up buying. But you have to go to the street and buy what you want instead of you could get in a prescription, and then therefore there's going to be less trips to the hospital. There's going to be like less abscesses, less people dying. That's all there is to it. People will not be dying if they get what they want and need. That's the bottom line. It's true. And the only reason that they're not doing it is because us junkies would be right. And that's what pisses them off. That's what would happen. There'd be less deaths.
Yeah, you're really treated like badly and poorly. When you go to the hospital and you give your zip code, like your area code, they realize you're in downtown. You see, if you have a regular, like a problem, like with pain or something, they think you're drug seeking or something because you live in downtown inside. So, yeah, those cards too.
Fair enough. Hey, so just another quick thing, where there's a lot of chatter in the chat right now about decriminalization. So January, for those of you who aren't familiar, next year in January, the BC government has approved 2.5 gram threshold of possession for opioids, meth, cocaine, and MDMA, not individually, total, if I understand that correctly.
Yeah.
Right. So that move has been lauded, right, as a big step forward in the right direction for systemic harm reduction. But what are the real life effects or the real life impacts, of a decision like that for our community, right? How does that actually play out in real life, where we decriminalize a small amount, but then where are the gaps?
Has to go up. The amount has to go up.
It's setting people up for failure, I think.
Yeah, it's just setting them up to go, you're allowed that minimal amount, but geez, you need more than that. They don't get it. That's somebody's fucking just cup of coffee in the morning.
Yeah.
I know in a couple of hours I can go through $300, no problem.
Yeah.
So we call that. So that's going to happen to a lot of people, but they have to raise that. They have to raise that amount. They have to. That's the only way it's going to work.
So even if they raise that amount, though, right? I mean, you can carry as much as you want. Let's just say that imaginary thing happens. What does that impact happen on? What impact does it have on the community as a whole? Sure, I'm not going to be nicked for having it, but I think the reason why you're doing what you're doing is safe supply regardless. Is that not a missing piece in all of this?
It might be.
Could be, but you never know till it happens. Yeah, like you said, Kevin, you just gotta fly with it and see what comes out.
Yeah, fair enough.
And
Jeremy,
if things don't work out, then just go back to the drawing board again or do what we have to.
Fair
I
enough.
think working with user groups like us and other ones like like I said, listening more, right? We have a lot of good ideas, but
I think they got to start in schools too. There's no sense in lying to kids. It's out there, and if the kids know what the real actual truth is, I think that's going to make a big impact.
Yeah,
Totally.
enough. Jeremy, I see your hand up as well, pal. You want to chime in?
Yeah. So I think decrim was something that the kind of drug user movement, including VANDU and Pivot, fought very, very hard for. And it is a very important step, but it's in the context of this sort of incrementalist government policy way of developing, which is complete bullshit in the context of an emergency. Decrim would have been good, 10 years ago, and potentially, could have helped avoid or mitigate the impacts of the drug poisoning crisis. But it's the really frustrating thing about decrim, and a lot of these responses that are created to deal with overdose, is that they aren't overdose responses. They're responses to the criminalization of people and everything that unfolds from that, which is also devastating. But don't masquerade it as something that's going to save lives. The only thing that's going to save lives is naloxone, overdose prevention sites, and safe supply.
Yeah.
If you don't have those things, or if you're not integrating them into the response, then it's not a response to the overdose crisis. So, don't sell it as one, because people are still going to keep dying at the same rates, maybe higher, maybe like the impact on overdose is going to be negligible, and it's incredibly frustrating.
Yeah, I hear that loud and clear. Caitlin, you've got your hand up as well. What are your thoughts?
Yeah, I totally agree with what everyone's saying. I mean, it's such a red herring to talk about overdose deaths in relation to decriminalization. And when government, we've been pushing for decrim for a long time to get cops out of people's lives, to stop the harm caused by cops and criminalization and incarceration. And government has always said, oh, it's not a silver bullet. No one who's advocating for decrim has ever suggested that it is a silver bullet. We've never said that. We've said this is a basic harm reduction measure. It's, to give people a legal pathway, like at best in terms of overdose rates, what we may see is that now people can get from point A to an overdose prevention site with drug in hand without fearing arrest, which was not the case before. While everyone is telling people to go to supervised consumption sites, go to overdose prevention sites, there's no legal way to get from your house or wherever to an overdose prevention site with drug in hand. You still face arrest. So this is kind of a basic thing to be like, you're not gonna get arrested, and to stop the harm of cops in people's lives. Even though, cops are cops, they're gonna be in people's lives no matter what, and they're gonna do what they're gonna do. But it's just like, this is necessary. No, it's not a silver bullet. Of course, we need safe supply. It's not going to result in people magically having access to, quality tested drugs overnight or ever. That's not what decrim is. So there's a lot of misunderstanding around what it is. And I think government is purposefully creating this model, which has an extremely low threshold, 2.5 grams.
Combined. I literally have more than that in my purse right now. It's not going to do anything. And yeah. What is it going to do? Let's talk about that for a second, right? We know, we've established, right, that this is, I don't want to say performative, but I mean, it's certainly, the fact that the government is willing to say, yeah, we're going to try to do a thing, based on what I'm hearing, it's perhaps not the most informed decision, but it's a decision in that direction. What will the outcome be? What will the the downstream effects of this specific legislation going in, and how will that impact the community?
It's a step, right? It's as we've seen, we do not have a government that wants to do big changes. They love incrementalism, and this is one of those steps. And perhaps we'll get to a place where enough provinces and jurisdictions will also be applying to decriminalize. It's like part of a movement. And maybe we kind of push the needle forward a little bit. And I think, for people that use very small amounts of drugs, great. This will probably be really good for them. They don't have to fear buying 2 grams of Coke or whatever. So it's not that it's not going to help anyone. It's just that people that need decriminalization the most because they're over criminalized won't be protected by this policy. So.
Okay. Jeremy, your thoughts? Thank you, Kevin.
Along the same lines, it's beneficial in that sort of process of incrementalism, which isn't appropriate in this situation, but is important. So if it goes well, maybe there's more public buy-in into things like safe supply and compassion clubs. That could be a positive outcome of decrim. But if it doesn't go well, and with these kind of thresholds that are being put in, kind of setting things up to be difficult and potentially not go well, and those thresholds were highly objected to by community members that they brought in to advise on decrim. They're like, this is not going to work. People are still going to be criminalized. you know, if it doesn't go well, then potentially that sort of support could slowly erode.
So you're saying if I have an adverse effect, right? Like, you know, government makes a step forward, but it ultimately, and again, I don't want to put words in anybody's mouth here, but creates a scenario that actually incites more problematic outcomes. Does that hurt? Would that not hurt the movement forward?
Yeah, that's basically what I'm saying. It's like this sort of, you know, half in sort of approaches to things, like, you know, don't really work unless you go a significant way in, or, you know, all in, right? It's like, oh, like, does water get you clean? Why don't you try a tablespoon and see if you get clean with that?
I mean, you're doing it wrong if the spoon isn't helping, Jeremy. So,
Well, we look at it as, well, this is learning for us too. If it screws up, like, you know, okay, we'll go back to start it again, go somewhere, like, you know, maybe there's something that we missed here along the way that we didn't pick up. But as the time goes on, what's like, you know, we'll learn from our own mistakes too. And we're not like, you know.
we pay the iron price when we learn from our mistakes.
Yeah.
You know what I mean?
Yeah.
So how do you change that narrative? We know, right, based on what we're talking about, we know that this is going to be, I mean, yes, it's a step in the right direction. It could potentially create a quagmire for people that it makes things very dangerous for folks out there. How do you advocate for the clear narrative on what's actually happened? What has worked for you to get the story out there, to set the record straight?
But that's why we have our meetings that we have here every week. There's always different things for different people where they can catch on to what can work for them, like, you know, which part of the program works for them, and get that information in there to them to make them realize, like, you know, this is what we're doing, this is what we're trying to do, but we don't, like, you know, don't take it to extreme, but enough to, like, you know, that it's going to work for us, like, work for you, work for me, like, work for everybody. Like,
There's always somebody that has a problem and they come to VANDU and they always think that they're the only one with that problem in the world. And what do you call it? But then they start talking to somebody at one of these meetings and they find out, hey, that person's going exactly through what I'm going through. That's what's so good about these meetings, that you'll always find somebody that has the same problem as you. And that's how you solve problems, by talking to other people that have those problems, and then you work together. That's what VANDU is about, working together with other people.
Well, you're
Working
building
peers on peers.
Right? You're building community and providing people a way to
That's
not
the
feel
only way you're-
isolated.
That's the only way you're gonna learn is by talking.
Yeah.
You know, you gotta just keep it up, keep these meetings going, and eventually, well, eventually,
like, I wish the
yeah,
government would do that and talk to each other.
and listen to us, you know.
Who do you want at the table?
Well, we go, I'd like a couple cops there. What do you call it? Like, not, like,
Careful what you're asking for,
when,
pal.
when it came down to this amount that is 2.5 grams, there wasn't even one person that used drugs at that meeting to decide the 2.5 grams. There wasn't like one person, everybody else was people that don't use. So how the hell did they come up with 2.5 grams?
Yeah,
It's
no
obvious
kidding.
that they don't know what they're doing. They couldn't get a person that used it there. So they need to go back to the board and get some users in there, and then let's talk then. And let's see what the right amount would be.
Nothing about us without us, right?
Yeah, nothing about it without us.
Jeremy, I see your hand up, pal.
Yeah, I mean, I just want to say, like, you know, to make steps forward, we got to realize, like, kind of where this problem is coming from, and it's overwhelmingly political. So to make changes, you need
Water is also wet, Jeremy.
So it's like, how do you build capital, and where does it come from? And one of the most effective ways that I've seen of doing this, and these are lessons that have come out of VANDU and all the amazing work and progress that they've been able to make, and that's by forming places where people who use drugs can build community, build capital, learn this sort of ways that they can make change or things that need to happen. And the only thing that's made change in drug policy, as far as I know, has been, direct action, civil disobedience. Lessons learned from the
That's what we are.
from the overdose prevention sites at VANDU, from the Compassion Club actions that are, gaining traction. It's all, taking steps with the support of your community.
So you have a national audience right now, right? How would you get other communities out there in the country who are listening now to start that? Oh, international. All right, fine. Thanks, Paul. So how do you get folks in other communities to take the steps that you're going into to make that change? How will you get them to follow that path? I don't mean to throw that responsibility on all y'all, but you got the floor here, guys.
I think Lorna's talking, but the mic is off.
Cool. I'm glad I totally did that. I have no control over that.
Okay. What do you call? I think. What did I just say?
Does that get the people from wherever?
Get somebody to phone VANDU. We'll send somebody from VANDU down to wherever they're at, and we'll show them how to get a group happening, and then they can go from there. We've done it already. We done that in Fort St. James. We done it in Williams Lake, where they didn't have anything. Like, I can tell you some stories of what happened there, but
Tell 'em.
A big difference in Toronto. Yeah, what do you call it? Anyways, but all these places that don't have that, phone VANDU. We'll send somebody there. We'll help them start a group.
You hear that? Everybody in this room?
That everybody on the international.
Also, one other thing. Ain't nobody works for free. You got me?
Yeah.
You call VANDU, you do it right.
Yeah, that's right.
Don't be a jerk. Nobody works for free, guys.
Yeah. Well, actually, sometimes I think we do.
Okay, listen, I get that, but I'm trying to stop that. Pay them.
Just shows how much we care.
Money goes here.
Money.
Okay, like money, yeah, we need it, but you know what? It's about the people. That's what we care about the most, is the people.
Yeah,
I hear ya. We gotta take care of you guys too.
yeah, it'd be nice.
Right?
We haven't had a what do you call it? Going away, a retreat. We haven't had a retreat in 4 years. Not even one. We need a holiday, paid holiday.
That would be nice.
Yes, it would.
Well, that's great.
Oh, geez. Oh, we had one evening we went out though, but that wasn't not the same as going somewhere and have fun.
So when other communities call you, are you finding that the situations, the scenarios are similar? Are you finding anything that's sort of out of left field for you?
No. It's always the same. It's always the same. There's always somebody here at VANDU that will know exactly what somebody's talking about. When they phone whatever their problem is, we'll have somebody here that goes through the same thing.
Like, yeah, we find somebody that's gonna, like, has a similar history as them, and that's who we send, so that they know what they're talking, like, they know who they're talking to, and the people feel comfortable with that person.
They're also welcome to come here too. We have all different kinds of meetings on different days.
You're telling me that you have folks in your group that you have specialized storytellers that you know the lay of the land.
It's called lived experience.
Yeah, no kidding.
Lived experience,
We have people of all kinds, all walks of life. All walks of life.
Yeah, I bet
all
you do.
different scenarios of where
we got
where they come
nurses working in our injection room, and we had to teach them how to save somebody's life. And yet they were actually a nurse, and we had to teach them. So the government, they phoned us, the mayor got us to go and teach them, him and his whole group, his office, how to use Narcan. So a whole group of us went down and taught them. So
how did that feel? Like, do you know what I mean? Like the amount of support that maybe the city had perhaps given you in the past, and now they're like, hey, can you just do this for us?
Yeah,
like,
we're going to do this for us.
Yeah.
I know, which is crazy. It's just like, you guys don't want us, but can you come and help us?
Ain't that the way? Ain't that the way, huh? No kidding. So let me throw that question out to Caitlin and Jeremy as well. Like, how do you get people motivated? How do you get people to advocate, especially from your angles of this situation too? I want you to both answer at the exact same time, speaking in unison.
I mean, I think it always has to start with drug user groups. Like that's the only way to do it. It's not possible otherwise. And so I think the key, like in terms of support, is needing to have a space that isn't constantly under threat by cities and police, because that's something that I hear about every week, is drug user groups around BC who can't even exist in a space without getting harassed daily by cops and cities, and having funding, right? Like these are groups that are doing this from a place of having barely any resources, and you're watching your friends die, and your space is under threat. So it's like, I don't know, I think just the ability to organize, meet regularly, have a space, and have a comfort in being able to do that is vital. That's the first step.
How do you overcome the whole gentrification of areas, right? We, like in Guelph, we used to have a place called 40 Baker, which is not dissimilar to what you're describing, and they got shut down because they got out rented, you know, they got gentrified out. Like how do you overcome that?
I mean, it's a constant thing. It's like I said, I'm talking to groups every week that are going through this, and I think it's about, you know, using all the tactics that you can, whether it's you get shut down and you have to set up somewhere else, you get shut down and you set up in a public space for a couple of days just to like make a statement and to show that you need space. It's talking to the media, it's finding friendly allies, people who will come in numbers to support that. But it's not like, I mean, I don't know how to overcome gentrification. I guess it's like people power, right? Like we have to start as a unity and as a collective. That's the only way that we're going to be able to kind of overthrow power as it stands.
Gentrification, get the fuck off our land and this is
You're here. You're here.
our land and get the fuck off of it. That land gentrification.
The whole concept of land transfer tax is mind-boggling to me. You know what I mean? Jeremy, any final thoughts on that as well?
Again, echoing, like, first and foremost, you have to support these community-led drug user groups. They're incredibly important to any sort of action that needs to happen. But you know, once you have those, or once you have a sort of, you know, community that can act, it's actually supporting them in acting, or finding ways that you can support them to act. Because once you get the ball rolling, you know, people love to jump on. You know, I'd like to believe that in Canada we have a lot of people who are good people who do want to help, and just don't know how. But you know, once you get things started, I think lots of people are happy to support, you know, financially, with, you know, their presence. And I think it's just about, you know, taking that first step, or supporting groups to take that first step. And you know, I think you wouldn't expect people to, you know, go out, buy drugs and start giving them out, but you know, there are more moderate steps that can also be taken. Like when overdose prevention sites were like the thing everyone was yelling about, people set up mock overdose prevention sites, and there's nothing stopping people from setting up mock compassion clubs either. I've never seen somebody do it, and it's, you know, we're going to help people start doing some in BC soon. But you know, that's stuff people can do on their own as well. I know there's lots of community events where, you know, people can set these up and really get discussions going. So it's really kind of finding ways to empower people to make a difference, because a lot of people don't know how.
So let's talk a bit about a point that you touched on, like mid discussion for that, about setting up your own compassion clubs, or you know, I mean, I've set my own non-sanctioned safe consumption sites in a few of my other jobs too, right? So I mean, this comes from the chat earlier on. It's from Sean. And like, I mean, they're asking a question about liability, right? I think you've already touched on sometimes there are nurses or nurse practitioners that are assisting with this. That, I mean, again, you have to train. How does liability play within this? And I know that you've had like an incredible amount of success where you've had 0 fatalities based off of, you know, the work you've done, but like, you know, what should people be mindful of in regards to liability to them to do this type of thing? It's all good to inspire them, but like, how do we keep people doing it? I'm going to make Caitlin answer this one because, you know, lawyer.
Sure. I mean, so there's no, like, oftentimes escaping liability is not possible. That is one of the risks of this work. It's the right thing to do, but legally it comes with consequences. But I think, you know, the more people that you have and the more organized you are, the more successful you can be, and perhaps the less likely you will be to bear the risk of liability alone. I think to the extent that you can, finding lawyers or legal-minded people to assist with strategies and kind of creative ways to avoid the hammer of the law. And I also think, you know, I hear oftentimes from people in the medical profession, nurses who are concerned about doing things like assisted injection or that sort of thing. And yes, there may be liability, but I always say, like, there's also liability in, like, presumably as health professionals, you take an oath to do no harm, etc. And it's like, there's also liability in not acting to save lives and in not doing the right thing that can easily and has resulted in death. And so what I always say to medical professionals is, like, organize amongst yourselves, like, find like-minded workers, people that you work with, and put pressure on the health authorities to say, we're going to do this. Will you have our back and will you protect us? And so again, it's organizing just on a different level. It's organizing within your profession and with your comrades, and like building that strength and pushing together to whoever is at the next rung on the ladder to say, like, we have to do this. We're going to do this. Are you going to have our back if there's a possibility of liability?
I love you guys so much. You guys are my people. So any other thoughts from our speakers about the liability play, or?
Yeah, you know, just same thing. There's always going to be liability. It's not like DULF has ever operated without tremendous risk. You know, some people aren't comfortable taking on that sort of risk, and you know, that's fine. Whatever, they can support in other ways, but I guarantee there are people willing to take on that risk that just need to be empowered and supported. You know,
Yeah.
lots of people message DULF saying that they don't care about the risk and they're willing to do it as well. So I think it's just about finding those people. And it's not fair. It really sucks, but that's the reality of the situation. Like, things can't wait for the ideal.
Well, we used to have that injection support team. We used to go out and teach people how to, like, these are the people that we're using, and they were doing it wrong. And so these were the ones that were going to hospitals and that. So we had an injection support team that went out into the lanes, and we would cover, if the cops were coming, we'd cover so that they didn't see what we were doing. We were helping them how to use properly, how to clean their, you know, clean right and all this, and it worked. Right. And so I think we need more like that too, to get out there and be out there on the streets helping these people that don't come into meetings, you know, that sit out there and just doing, they don't really get taught the right way, you know. And so I think that we need more teams like that to go out. I think that would help a lot.
I think in liability, like Caitlin said, you get your allies, your comrades that fight with you in civil disobedience. Sometimes you have to face that, and that's just, you know, fine line of being legal and illegal. And so yeah, just, you know, teach everybody, you know, give them a little heads up on disability or civil disobedience, and have some lawyers in line just in case it goes south or something. But yeah,
So
we have
Jeremy,
to do that sometimes.
Yeah.
One of our staff just got arrested. Well, she got put in handcuffs and then let go. That was just a couple weeks ago. That was on the street sweeps. That's another new thing that we're doing. Her name is Hannah. And Vince. They both got arrested but let go. That's our staff. We have to laugh about it.
So that brings me to another question. Jeremy, I see your hand up. Let me follow back with you in that for just a second. This whole concept ties into a question that was brought up in the chat as well from Katie. The question is this: how do you create political will that does not exist? Right? It's a struggle. People who use drugs have had to take those risks to demonstrate illegal actions, like OPSs in the past. And then they work, but Katie really hopes that the same outcome occurs from the Compassion Club evaluation by DULF. So I'm not allowed to say the things that are in that rest, but you can find that in the chat, because you know it's a career limiting move for me. But I mean, how do you generate political will where there's an absence of it?
Yeah, I think it's, you know, I think the lack of political will, I mean, at least in this situation, comes from misinformation. So, you know, finding ways to inform the public is a really, you know, powerful way of doing that, and you know, capitalizing on media and attention is a really good way to do that. And that's the way that, you know, DULF has done it, is by, you know, leading by example, and that can help, you know, really correct a lot of things really fast, by showing that the sky doesn't fall down. So that'd be my 2 cents on that.
How effective has that been for you?
Incredibly effective. You know, this, and then, you know, maybe other people have different perspectives, but you know, we've been seeing movement on safe supply and more support coming from actors who were previously kind of more indifferent. As we've, you know, acted and become more visible, you know, more support comes in political and institutional capacities.
And I think also, like, you know, the more consistently you're meeting, you're slowly kind of becoming more visible. You have to just keep going and like be annoying, like just keep doing it. And I think, you know, like VANDU is a really great example of an organization that has built relationships with all different types of people, right? Like VANDU has relationships with people like allies in the medical profession, in the legal profession, some people in government. Like you've got to kind of, and different people will bring different types of knowledge and expertise, and we all have our role to play, but it is really about building connections and kind of branching out, and that isn't going to happen overnight. Like it's the long haul, right? Like you have to just keep going.
So that answers a few questions that we had. We pre-pulled some questions earlier from our audience members who were keeners and decided to send questions early. You're on screen. Forgive me if I'm pronouncing your name wrong. Is it Juan? You know, the question was, in Alberta and elsewhere, we are seeing increased coordination between local police and provincial addiction treatment policies. What strategies can communities employ to ensure community members are protected from coerced treatment? And you guys have sort of outlined, as our panelists here, like, you know, civil disobedience, you know, covering folks when they are about to use, or, you know, creating scenarios where you are, you know, creating very surgical advocacy. You know, what more can be practically done for people who've never been sort of initiated to that sort of type of, I don't want to say guerrilla advocacy, because I think that gives it a very specific tone. But
Join the group. Be part of it. That's all you get to learn. Become part of it.
Okay.
Yeah, I mean,
Don't be scared.
I know, I think that was from Ewan.
And that's probably how you say that.
You know, who works with you know, kind of drug user groups in Alberta, and you know that the situation in Alberta is like fucking horrible. It's really like so far out of, you know, my expertise on how to deal with this coerced treatment. I know, you know, probably VANDU has dealt with this stuff more than I have, or maybe Caitlin, but like I think it still comes, you're just starting in a way worse spot but it still comes with, organizing and, really, like Caitlin said, like really being annoying and being vocal about, why this is really horrible. And it will probably take a long time and things seem to be moving backwards, but persistence is key, I suppose.
Persistence. So on the topic of persistence, then, a question from either it's Rochelle or Rachel. Sorry if I'm mispronouncing your name. English is my second language. The question is this: what can we do to strongly encourage governments to make safe substances of choice available to everyone? And I know we've touched on the types of advocacy points of actions, but I want you to drill down. What are the words you want people to say to make sure that narrative is brought across in a way where, people's political futures might depend on this or not, right? How do you get people to hear that?
Yeah, the government doesn't give a fuck. We've a meeting with the minister in 2 hours, and we've given them all the information. It's so far.
If it was their family, if any of the government, if they had their family into the drug scene, I think they would think differently. So what do you call, maybe tell the government, think about your own family. What would you do if your family was using? Maybe think about that.
Yeah.
Sorry.
And the government doesn't act on its own accord. The government doesn't proactively act or act unless it's really in their faces. They're really good at responding to things that make them look bad. So, that's why, DULF applied for the Section 56 exemption. The SUAPs got declined or, intended to decline. And we sent them a letter saying, okay, thank you. We're going to do it anyways. And then maybe you'll do something then.
Anyway.
That's the VANDU way. Yeah.
Mm.
So that's DULF and VANDU.
We can now questions later. Yeah.
Okay, fair enough.
Later.
Okay, so that brings me to another question from the group as well. This is from Renata. What, based on everything that we've said now, what are municipalities doing right now to actually support you then? I mean, if we're talking federal governments that are kind of not opening their ears to this, what are the municipalities doing for you?
Well, they're basically just the same thing. They don't do anything. It's I don't know. It's they'd rather get rid of us than try and work with us.
What is the thing that you guys are going into?
What gives you that impression? What are you seeing that gives you that feeling?
Group on groups, or
Yeah.
Oh, the one we're going to, that's starting because of the one thing changing.
So what do you think, Flora? What are you hearing from? What are you seeing and hearing from municipalities that give you that impression that they don't want you there?
No, because every little time we need something or trying to fight for the people down here, they don't give it to us. They've given how many millions to the police. Meanwhile, all that millions they gave to them, they can house those homeless people down here with that and they'd eradicate so much of the homelessness instead of worrying about paying so many cops or adding more cops. And they're the ones harassing the homeless. They're stealing from them. They're
They're doing home invasions when they go into their tents.
Yeah, doing home invasions when they go into taking their tents and stuff, because they're trying to grab whatever they have in there that they can keep for themselves. Everybody knows that. Plus all the jackups they do on the dealers, they used to write you a receipt years ago about how much money they took off you, how much drugs they take from you. They don't even do that anymore. They take 3,000. What nobody's gonna know, it's the 4 or 5 people that are there. The cops, so much they split amongst each other. Can't say that they don't because it doesn't seem to show up anywhere. We can guarantee you, I go there and ask, I want my money back. I'm not being charged. What money?
What money? There's no paperwork.
There's no money. There's no paperwork.
It's like that old joke. I better not see you using my skateboard out back. Is that?
Yeah.
Okay, Caitlin, any thoughts on that?
I was just going to say, I mean, like it's obvious that municipalities are opposed because we just see it in these very material ways every day. Even if Vancouver as a city says they're supportive of drug policy, blah, 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 what we see on the streets every day, like they are, you know, the city budgets, the police department, the mayor is the chair of the police board, like these things are deeply connected. And when we see things playing out the way they are, we know that the municipality is behind that. And you know, outside of Vancouver, like I said, like municipalities throughout BC are single-handedly shutting down and preventing from opening drug user spaces, overdose prevention sites, supervised consumption sites. I think, I don't know how successful this is as a tactic, but I mean, the provinces and the health authorities are supposed to have responsibility over health to a certain extent. And so what we've been doing is oftentimes when municipalities are getting in the way of drug user spaces, going to the health authorities and the provinces and saying, you're the superior level of government. This is your responsibility. You do have the power. Here are all your powers. It's time to step in and prevent municipalities from doing that. And any health authority or province that says otherwise, that says, we don't want to step on the toes of municipalities, we don't have the powers to step in the way of municipalities, is absolutely incorrect.
It's a shell game.
What's that?
It's a shell game.
Yeah, it's always finger pointing, right? But it's like, it's kind of ridiculous when you have these superior levels of government that are saying we're powerless to stop municipalities. It's like,
Oh, Caitlin, when was that thing when we did that work with was that the mayor and that? When they came and asked us, they already had it written down 2 days before they even came and asked for our approval. And we told them to go fuck themselves.
yeah, yeah, Flora.
Well, yeah, Flora
Is it a
did.
form letter already pre-written?
Yeah.
Yeah, they'll come and they'll be like, oh, we want to get your input. And then it's so obvious that they've already figured out exactly what they want XYZ policy to look like. And then they come to VANDU or other community groups at the last minute to pretend that they're actually consulting, but they're not. And I think it's like in those moments, and you know, in that meeting, Flora like ripped them all new assholes. And it was really powerful. And it was like, we didn't get our way, but like, you need to hold these people accountable in whatever way is possible, right? They just
And that's the
can't
thing,
let them get away
I
with it.
won't hold back. It's just like, you want to fuck with us, screw you back, man. Like, the fuck? We ain't helping you. We're not gonna, like, you know, we're not gonna sit back and let you, like, you know, screw us over.
There's so much to unpack about everything you just said.
I even asked them, I said, what do you want us to do? I said, bend over, dry hump there.
Oh God, I love you guys. So okay, let me just tie this back. We talked about, you know, systemic stuff. We were talking right down to the community level. Let's go more. Let's focus this in a little more individually too, right? So I've got a question from some of the group as well. This is from Riley, and the question is this: how would you respond to somebody who is extremely upset about an agency handling out clean gear despite asking for it, right? So we're talking now about probably the general public who's a bit uninformed about life, you know, in regards to what we're facing. How do you manage that on a one-to-one basis now?
Say that again, the last part. One on what?
So like if a community member or like, you know, somebody who walks in a world outside of the world that we all live in, like how do you handle them when they start to like object to what, you know, what you're doing to save lives?
All you do is just explain what you're doing and why you're doing it and the results, the outcome, and saving lives. Like, you know, like that's all. It's the bottom line, right? So try to explain to them, and if you win them over, or if they understand, they understand. If not, I don't know. You know, you can do what you can do.
You can just say the truth. That's it.
Yeah, that's all it is give them the truth, plain blank out. If they don't want to listen, like, don't let the door hit you on the ass on the way out.
Totally. And
I gotta stop laughing at that stuff.
I agree. And I think it's like, don't let one person be the hill to die on. Like, if they're not going to agree, then fuck them. There's too much other important stuff to do, i.e. saving lives, than to try to convince individual people of
You're always gonna
what's
find
right.
a person out there like that. You're always going, there's always somebody
We-
that
we
they
get
just
those
wanna be
every-
that way.
Yeah, we get those almost like at
Daily.
least 4 or 5 of them a month
Yeah.
that we go through, and it's just like we talk to them. Like even like, one-on-one even to try and put them aside, talk to them and that, and try to explain to them what we're trying to do. Like, about 70-80% of the time we get them. They understand it, then
That's not an arbitrary number. You think that around like a B plus, like if you're giving yourself a grade, you're giving yourself a B plus.
In our
on
groups,
success
from
rate
our
for
groups,
this.
yeah,
Yeah, from our groups and that.
yeah.
Okay.
From our groups, we're pretty good, I think.
Mhm.
Oh,
But I
yeah.
think, but I think there's always gonna be somebody that, no matter what you say, they're not gonna listen to what you say. That's all there is to it. There's a lot of people that just, all they wanna do is argue, and they're never gonna take anything that you say to, home to talk about.
Yeah,
Huh.
that's the sad thing about those people, is because they don't want to learn anything. They just want to be stuck in their own little
Fantasy world.
world.
That's a lot to have to shoulder. I mean, you're in the middle of trying to save somebody's life. You're in the middle of setting up a system and lay the foundation to make sure people that are loved and that will love and that do love are being taken care of. And now you got to deal with Weisenheimer's breathing down your neck.
Yeah.
That's a heavy burden to have to carry, which is my segue to my next question. This is
I
from
gotta go feed my
Tanika.
puppies.
What's
I gotta
that?
go, I got my dog had puppies and she's not feeding them as much as she's supposed to. So we've been feeding them by syringes.
This entire COP now is about your puppies. This is over. We're switching
You know,
gears.
I have to go and feed them. There's
Okay.
3 of them.
Well, that brings me to that's directly in line with the question I have from Tanika about asking how are we or how can we be more involved with the mental health and trauma response that is associated with drug use, right? Like how are you guys
That,
managing it?
we need more education. I took a course when I was in Manitoba where we took a mental health trainer. Like it's not a mental health worker, but a trainer, like to evaluate whether they need the help. That's the kind of education like we need to be brought here. So this way we know the difference between who's got issues, who doesn't, like who's just jerking your leg and trying to pretend to be.
We've had it here where we're saving somebody's life, and the guy that works for the ambulance, he turned around and said that we're not first responders. They are, but yet they had to come, and it was somebody that we were working on. So I don't know how he got that. When I asked him, he just said, "Oh, shut up," and walked away. So didn't know what to say.
Yeah,
We're not
mean-
responders.
we're not considered first responders. We're just a bunch of junkies trying to get junkies and keep them alive. To bug you guys.
That is a question I have to address like twice a week in the stuff we do. Jeremy, I see your hand up. What's cracking there, pal?
Yeah, sorry, your question was on mental health and substance use.
Yeah.
I kind of been harping on this a bit lately, and it's something I see is really flawed in how BC has been setting up its way to respond. So they created, and federal government just recently did this too. Is they created a Ministry of Mental Health and Substance Use, which is bullshit, because it's intrinsically kind of linking mental health and substance use together. And there are certainly times when they can be. There are people who aren't mentally well who use substances, and that could exacerbate it. And in some contexts that might be useful, but not always. And I would hazard most of the time not. And I think it's a really, really flawed approach to loop those two things together and try to address them intertwined, because lots of people just use drugs in a just fine way. I mean, like I'm sure a lot
Recreationally, like why the heck not?
Recreationally, or even if they're dependent on it, like if they can still function and in a way that they're happy with and aren't causing problems for society, or if those problems that are being caused are systematically imposed, like that's a systems problem. That's not a mental health problem intertwined with substance use. Like and all these things were formed in response to the overdose drug poisoning crisis. And, you know, we don't, you know, nobody cared before there was an overdose crisis about, you know, mental health. We had like Bell West talk, like what the fuck. So
Full disclosure, they funded one of my programs. I'm just gonna put that out there right now. I got money from them. Okay, just
yeah. So, you know, like it's not like we need to address overdose, and you can't, you know, form these things like those are all responses to, you know, like really chaotic patterns of substance use where people might need help, but you know, they shouldn't always just be together. I think that's a really
it's skewing a narrative on people's lives, right? And it also creates systemic stigma around, you know, what we're working with, right? So there was a question that also came in as well. This is more directed at VANDU, and this is from somebody named Katie. The question was, how do you define lived or lived experience with experiencing substance use?
On the lived experience.
Yeah, I mean, this is a question maybe for VANDU. I mean, I guess we're asking, like, you know, what that threshold looks like, and I mean, I would argue that, you know, frankly, it's if you've got the experience of using it.
Well, yeah, having the experience of knowing, like, you know, being the drug user, and what, like, you can't really define one person's experience like with other, but determine almost to the exact same thing. Like, you know, it's like I was just reading some of these ones about the reserves and that. It's just like being Indigenous, you know it. We all know each other of it because we're all Indigenous.
It's like somebody like that goes to school, university and stuff to get in the medical field or whatever, and so that's their ticket, you know, their you know, and me, that's my university, was the streets since I was a young boy, right? And coming up, and I've been through and done a lot of things, and so it's worth its weight in gold today, because you know, I've co-written on medical journals with some people, and you know, it went into American Medical Journals and stuff like that, and it's the truth, like the real, you know, truth of that, you know, someday somebody will read and start studying, and they'll get the proper answers.
Mm-hmm.
Yeah, because like years ago, with a lot of stuff, with things that people read out of the book, like say, like with Child and Family, you got a person that goes to school, gets their degree, but their whole only history is what they read out of the book, and that's it.
Right.
But not where an actual case can be made into those textbooks of actual people that lived through that, of having their kids taken and the process they went through and all that, and then what's happening to them. You don't get that in there.
Yeah, fair enough.
But with lived experience, you get every little single detail of what you went through and still going through, or now you deal with it, and why you do the, like, why you keep going.
Yeah, well, tell you what, how about I bring Kate up, or Katie up. Katie had, I think, wanted to drill down a bit more into that question. Katie, can we get Katie unmuted so that they can, there you go. Katie, why don't you bring your question to the floor?
So much. Sorry, I tend to like insert myself into conversations. I guess, yeah, like I do have concerns. Like I'm seeing all experience obviously is valid, but I'm seeing like, so I'm from the substance user network of the Atlantic region, and like I'm seeing people at tables that have lived or living experience, but there's different degrees, I guess, and sometimes I feel that it's hard for people to maybe relate to others in a drug user union. That I'm not suggesting you need to have, you know, been criminalized or been homeless to understand, but there's different, like, it's a spectrum. And so I almost see like some getting stigmatized or judged by others that don't have similar lived or living experience.
Yeah, we get that a lot with that too. It's just like, you don't have to be homeless to be like being an addict or having, like, you know, like, you could even be a weekend warrior and still be an addict and still have experience on that. That
Yeah,
doesn't
I can understand what you're saying, like people being judged, like other people, like with their education and stuff. But I don't like. I take that in, like when I'm at a conference or anything like that. Like what they're saying is very, you know, it's gold to me too, right? Like so, but I imagine some people do judge, you know, I don't know. That's what it's about, but
yeah, it's just what do you call it? It's just the hierarchy of everybody's. They just have to have their opinion of how this is supposed to be, where ours is like, you know what, I don't give a shit what your life is about. We still do drugs, we're all in the same boat, so that's that.
We're not playing a
You're
game
not
of pain
labeling.
Olympics, right?
No, there's nobody here labels you of anything. We're all in the same boat, so it's just like, let's work together with it.
Fair enough.
Yeah, I'll just
Yeah.
tack on that you know, I used to work with the BC Yukon Association of Drug War Survivors, and that term drug war survivors wasn't incidental. It was, you know, it was very strategically used to sort of differentiate between, you know, people who might have casually used substances and people who really experienced harms that are, you know, warlike from, you know, criminalization of drugs and drug poisonings, you know, having their community members die, their family members die, being incredibly criminalized and marginalized. That was, you know, a strategic term to sort of, you know, differentiate between, you know, a guy who uses cocaine on weekends and, you know, somebody who's had their children taken away because they were found with substances. Like that's sort of one way that a group has sort of tried to address that. But, you know, when it comes to government tables, you know, you got to think, what are they really looking for? And, you know, I think what it comes down is like, it's tokenistic. So when you have people who present and speak really well and, you know, like haven't experienced that marginalization and like they love that. They love those people coming to tables because like they aren't like super radical like the people who have really experienced that. So it's really hard to address that at government table. And, you know, I don't think it's been done here. You know, that's just my.
Do you find when you are trying to get support, right? When you're trying to garner collective action towards your goals, oftentimes, and I listen, I've participated in this as well. Do you find that in order to garner support, you almost have to fetishize pain to get people to buy into what your topic is, right? Because I mean, if we start talking about people who are, you know, functionally chronic, that's, I mean, yes, that's still a problem, but do we have to keep saying it has to be this many fatalities for you to listen? It has to be this extreme for you to actually support us. Like, what's your experience with that? Are you finding that?
We never say that. Like, you know, Lorna's lost 2 daughters. I've lost a son. And it's like, we don't go up and we talk about all that. Once in a while we do. It comes up. And that's what keeps us going, is because we're fighting for the fact of like, we don't want any more going. We don't want, like, especially when Lorna was bringing up about the kids, bring that up in schools or high schools. Bring that up. Like, you know, you can't hide anything from them. They're going to try it. They're going to do it. And who knows, like, you know, they've been in care all their lives. they go look for their parents and they're doing drugs. What do you think they're gonna do? Like, oh, well, maybe I'll try it. So it's just like, be honest with them. And that's what keeps us fighting. It's just like, you know, you gotta open more doors to getting to these people to understand, make them understand, like, but the thing is, like, you know, it's not for everybody.
Mm-hmm. Yeah, thank you for sharing that. Jeremy, you've got your hand up as well. What are your thoughts?
Yeah. First, I want to hop back to the last question. I forgot to mention something. You know, at these tables and with people who aren't really representative of the community or people who use drugs, they're usually individuals that are coming in and acting. And I think that's a really kind of weak point that groups can act on, saying, you know, we don't want individuals who aren't affiliated with any sort of organization representing the voices of a whole group. You know, that's partially, I think, why, you know, like groups like VANDU were started. So there's accountability to the community by who's ever representing them. And I think that's a really good way to phrase it. It's like, we want to elect our people or choose who's representing them through a group that is composed of the people that they're representing. Stop bringing your kind of hand-picked drug users to the table. Like, let us pick who we want to represent us. And then to the next question, I don't know if kind of fetishization is the right term.
I agree.
You know, I think it's a term that's supposed to make people feel a little uneasy, but you know, I think just stating facts isn't really, you know, fetishizing it. Like, you know, 2,000 people are dying in BC, like, we can do something. It's really kind of being able to leverage the situations that you're in to try to make change. And, you know, we wish we weren't in these situations, but you know, don't throw the baby out with the bathwater, I guess. Like, you got to use those things. Like, you'd be foolish not to, I think.
Thank you. Caitlin, what are your thoughts on that?
I was just gonna say, yeah, I think for sure, like, we've all been on tables and panels with government where there's oftentimes this expectation that people who use drugs just like share their sort of like traumas and experiences with the drug war, but then when it actually comes down to like decision-making power, they just keep that for themselves, which I think shows kind of oftentimes the tokenistic nature of these government tables. Is like, they want one thing, they want like a sob story, and then they're just going to do what they were doing all along. And so I think that's part of the importance of, like, you know, I've attended tables with VANDU and other groups who made a decision beforehand, like, we're here so that we can have decision-making power, and this is the role we're going to play. And if they ask us personal questions, we're not giving that. Or we are, like, it's a strategic move, right? Like, you have to decide what makes sense in that moment, but make it be on your own terms and not the terms of someone in power who's wanting one particular thing from you. So I think just kind of like deciding for yourselves what you want to share and what you don't want to share.
Sorry, somebody at VANDU, did you have something you want to share?
No, I just said for them just trying to be nosy. I said, your business about my head.
You kind of want nosy though, don't you? I mean, like, for the amount of packaging we have to put around some of the narrative, you want people to dig in a bit, right? I mean,
yeah.
How do you get to transparency?
Sometimes things like that you just want to keep to yourself. Like, nobody needs to know, or not. I don't want anybody know. Personal thing I like to keep to myself. One personal thing in my life I like to keep.
Yeah, no kidding. No kidding. You gotta stop posting stuff on Instagram, pal. We all follow. Well, that's great. So listen, folks, this has been probably the most
Interesting.
wonderful afternoon I've had in, like, what, a month, 2 months, 3 years. This has been like the best one. I just want to say a quick thank
Come
you.
visit us more often. You'll have loads of fun.
Every 3 months, pal, get on in. So like, I just wanted to say thank you, you know, just a quick thank you for our speakers for, you know, we've drilled down like super hard on a lot of the questions that we've had for you. I want to just say thank you so much for spending your time with us today and also doing all of the things that you're doing. You're clearly
I was actually calm. I didn't become a sailor this time.
there you go, right? But just, yeah, you know, from all of us, thank you. I mean, you know, this is such a needed, you know, community focused directive, and I think it's a shining example of what we should be doing in all of our communities. You've literally laid out how you do this thing all the way forward. Just a quick shift in our discussions, just so we can you know, bring this all back at the end of this, but just a quick shift before we get into our closing remarks. I'd just like to bring Carly back up so that they can chat with us about, you know, our thought exchange. That's how we used, that's the tool we use to collect our data here. And that lets us, you know, get the information we need to keep our COP fresh and relevant to all of your needs, because, you know, you're going to tell us that info anyway. All right. So Carly, do you want to just take the floor and let us know how it's going to go?
Yeah. Hey, everybody. I wanted to thank you all so much for joining us today. It means so much that you come and you participate and that you sit at the table. And we love all of the input that you give us and are so grateful that you engage. We make these spaces for you and we're happy that you're here. I'm going to post a link into the chat now, and that's for our thought exchange. So you can access it that way. I'm also going to share my screen, which is going to show a QR code, and you can scan the QR code. So for this, if you guys could just hop on to our thought exchange. It's just an event or
Wow, that went full screen.
there we go. Sorry. It is a survey to hear what you guys want and what you need in the future, so that we can inform our future community of practices to make sure that we're meeting the needs of the community and getting you guys what you want and what
How
you
do we
need.
keep this?
They'll record
Pardon?
it too.
Oh,
You
okay.
want that picture?
Yeah.
I can
So,
earlier.
sorry. So this is 100% confidential. None of your information will be recorded with this, so you guys can give your honest opinions, your honest thoughts, give us any feedback that you want to give us, what you think needs to be improved, what needs to be changed, what you enjoyed and what you didn't. I'm going to start a timer for 4 minutes, and then we'll get back to the regularly scheduled programming, and Bang will hop back on. But if you guys could just take a minute to fill that out, I would really appreciate it. And we'll talk about the question at the end, the conversation question. So Bang can have a little chat about that with everybody.
I talk a lot. You're welcome.
Yes. We appreciate it though.
You know what? I should probably do the thought exchange. I didn't think to do the thought exchange. I'm not going to do this one.
No, you do too. Everybody gets to do it.
I'm not.
All right.
I encourage all of you to, but I think it'd be like biased coming from me. I am merely a vehicle. I was just going to make a career limiting move by saying a joke, but I didn't. You're welcome, Sean. All right. I think I know only one Sasha Hill. Sasha, are you my Sasha Hill? Just pop into chat if you're going to say something. It's weird when people from like my normal life Oh, Sasha. It's so weird when people from like my normal life pop into these things. Like you're all my work pals, I'm sure right now, but like this is like Sasha and I go back to the old days of high school in the 90s. Right. Yeah, I'm 41, pal. Just so you know. And I look great.
Not a day over 40.
Not a day over 40 and a half. You mentioned that in every class that I'm 41. Why are you doing that? You're the worst. All right. So, Carly, remind me, am I reading off all the stuff that it's coming through, or are we just that's
yeah, I think we're going to take a couple minutes. I'm going to allow everybody to unmute if we want to chat for a minute, and then we're going to talk about some of the answers that we got to the conversational question, and we can discuss that if anybody wants to stick around. If not, you're welcome to leave. Once you're done filling out the survey, thank you guys so much for joining us today. I really appreciate it. Bang, if you want to hop in with some closing remarks.
Closing thoughts. I thought I haven't.
Yeah,
really
it's all you now.
bit.
It's all you now. Go ahead.
All right, whatever. Fine. Now you know you ruin it. It's fine. But yeah, just listen. Thanks, everybody. Like, I mean, I want to just thank our wonderful speakers again today. You know, our friends at VANDU, Caitlin from Pivot Legal, and of course Jeremy from DULF. You listen, like, we are so like everything that we do for the most part is like post-event or as much prevention as possible. You're literally so ahead of the game. You're trying to put the fire out before the fire even starts. You know, and I'm certain I can speak for all of us here at SJA and tell you that we absolutely appreciate you for what you're doing, and we thank you deeply for sticking your neck out like that and getting out in front of this thing, you know, when we're all still behind it. You know, we're all here trying to do our best, but you are literally light years ahead of everybody. So thank you for all the noble work that you're doing, and it's making all of us as a community greater because of it. And again, just a reminder to everybody else that the video of this discussion will be posted on our site soon, probably tomorrow.